I've been facing this for the past few days. I've been having a lot of patients coming by and asking to plan a delivery on the 22nd. Now, as an obstetrician, I'll be very frank, I would not suggest you to do something like that until and unless your delivery date is around the 22nd of January in the first place. Second place, if there's any indication, concrete indication for you to deliver, then yes. But pre-planning it 2 to 3 weeks ahead would be something that I would not suggest. And most of the obstetrician, I'm sure, will agree with me over this. There are some very stern indications for a cesarean section. Sometimes nowadays, so it's so common that now women actually want to go ahead for a normal delivery even after cesarean section. So for me to plan a delivery so it happens exactly on the 22nd, then we may have to induce the patient on the 21st and see how she's progressing towards it on the 22nd. So until and unless there is a concrete indication to do a cesarean, then I would not suggest you to plan something like this. Example, say you are around term. If you've got your due date or delivery date around the 22nd of January, then okay, fair enough. If you are crossed a particular maturity phase, fair enough. But if not, then I would not say please do it on that day. For whatever reasons, for me, the major concern would be the mother and the baby. So if the baby is preterm, even if it is close to 36 weeks, I have some of them who asked me 36 weeks, it's anyway a completed 9 months, so please do it. No, the chances or the complications associated with a late preterm also is pretty high. These late preterms, the baby may have complications. So until and unless it is not indicated, if the mother is not having severe complications, the form of a small pelvis, the baby is too big, and there is any constriction in the passage, or if there is a big fibroid in the cervix or in the lower part of the uterus, not letting the baby come out, or if there is a malpresentation of the baby, Andre, when the baby's head is not correctly positioned down. So depending on the various indication, or say even placenta, if the placenta is covering the os, I wouldn't say I will do a normal delivery. So these kind of indications, and if you're close to term, yes, we can definitely plan. But if it is not close to your due date and it is not definitely suggestible for you to go ahead and opt doing something like this, for my patients I would definitely suggest, if you're around the due date and if it's an indication, I will do it. But if it is not, I will definitely not agree to this particular request. First of all, uh, I would not suggest my new mothers to go ahead for a cesarean only because you want it on the 22nd. It's a surgical procedure. It has its own complications associated with it. If there is no go, then doing a cesarean matters. But just doing it for that reason, it is a major surgery. You will definitely be facing anesthesia, the long-term stay, and the multiple layers which is cut open, the complications in the form of excessive bleeding during the phase of cesarean. All this is going to be there. Now, talking about the baby, if it is close to term, the baby's lungs are mature, good enough. But if the baby is preterm, if it is less than 37 weeks, then there will be chances of the baby getting complications in the form of respiratory distress or low blood sugars, hypothermia, that is the baby can also have certain complications in the form of infections. So these are the few complications which the baby and the mother could face. If you're planning it, if it is not around the due date, and also it is not an indicated cesarean section.